All right, so welcome to the session focused on wildfire smoke. I'm your moderator, Jeff Pierce. I'm a HAQAST member. I'm at Colorado State University. And our first speaker today is going to be Mary Ewell from the Western States Air Resources Council.
All right, well, we're okay. I'm Mary Ewell. I'm the executive director at the Western States Air Resources Council, which also incorporates the Western Regional Air Partnership. We're an organization that brings together the 15 westernmost states. If you think about Alaska down to New Mexico, Hawaii over to the Dakotas, those are all the states that are members of WESTAR. They come together in WESTAR to discuss air quality issues of common concern. The Western Regional Air Partnership expands out from the states. It includes all the states within WESTAR, but also all the tribal and local air agencies, as well as EPA and the federal land managers in the West. So through the entire organization, we're talking about air quality issues of interest to the West. And today I'm going to tell you a little bit about the exceptional events demonstration tool. The West, some of you may know a little bit about exceptional events. It's actually part of the of determining whether an area is an attainment or non-attainment of the National Ambient Air Quality Standards. The exceptional events within the West, incorporate prescribed fire and wildfire smoke, as well as stratospheric ozone intrusions and high wind dust events. The West has always been kind of thought of as sort of ground zero for exceptional events that affect air quality. And I think this summer we saw that that is, perhaps we're not the sole ones at ground zero, as we saw wildfire smoke throughout the whole U.S. So the exceptional events demonstrations and exceptional events have been in the news recently this week, getting some press. What these are, they actually are not, it's not some magic wand where states, local and tribal air quality agencies can just at will get rid of data and EPA would somehow just magically agree to that. They actually require significant staff resource time, a lot of analysis of the data to figure out whether an event actually affected a monitor on a particular day or in a particular year, and there is a lot of scientific expertise that's required to complete these demonstrations. They're generally on the order of a couple hundred pages. So think of perhaps a master's thesis or something of that order every time a state, local, or tribal air agency is looking at an exceptional events demonstration. The one of the difficulties of exceptional events demonstrations is that you don't know you have an exceptional event that affected a monitor sometimes until years later. And so collecting the elements, particularly satellite data that might not be available or archived, is certainly an obstacle for folks working on exceptional events. We do know that many of the meteorological drivers for what exceptional events are increasing with climate change, and so we do think that there will be likely more exceptional events demonstrations needed to be submitted by states, local, and tribal air agencies into the future. This is a little, this graph shows you, and this is from the Government Accountability Office, folks that do a lot of looking at numbers and diving into issues. This is the number of wildfire exceptional events, and that's really, wildfire exceptional events are what the West is most focused on. Although there are other exceptional events, wildfire exceptional events are increasing. This just gives you an idea of the number of submitted exceptional event demonstrations through 2020. And as you can see, 2020 was the most numerous number of exceptional events demonstrations. But there's a number of things that have to occur for your exceptional events demonstration to be concurred upon, and that would allow you to remove the data that exceeds due to the exceptional event. And in fact, you can see that that there have been events that were not concurred upon for wildfire smoke, and even some that are just deferred, and that's usually because they don't have an impact on the regulatory significance. And regulatory significance in itself is another very difficult thing for air agencies to determine. I'm not going to talk a lot about that, but the main point of this graph is that the number of these wildfire exceptional events demonstrations is somewhat increasing, but as you can see on the y-axis, I mean, we're not talking about large numbers of exceptional events demonstrations. And when we talk about ones that have been concurred upon, we see in 2016, we had 8 that were actually accepted by the EPA and agreed to. So we in the West have been thinking about this a lot, and we're actually creating an exceptional events demo tool, and it's being crowdsourced, I call it. Various agencies in the West are donating staff time towards coding and creating this exceptional events demonstration tool that will sort of automate many of the elements that need to be incorporated into the demonstration. And so the idea is to streamline this for the states and make sure that states, local, tribal air agencies are able to not only complete these more efficiently, but also archive the data they need as the event is occurring, so that in the future they can have that data available. As I said, Westar RAP manages and coordinates the entire project, but our architects of the tool are Melissa Maestas and Ranil Damapala at South Coast Air Quality Management District, with also, I should say, thanks to their supervisor, Scott Epstein, as well at South Coast Air Quality Management District, because they have the sort of the vision for this. And so we have individual R coders from throughout the West that are working to develop the elements of the app that allows the exceptional events demonstration to be put together. And then EPA will eventually be looking at these submittals and will incorporate their feedback into the app. So just a quick little look at this, because we don't have time to delve into the entire demonstration tool, but you can see across the top, those are elements that are required in the exceptional events demonstration. And I think that probably the biggest one is that clear causal, that the event actually, there's clear evidence that the event caused an exceedance at a monitor. So, and we have some kind of really cool things worked into the app where, like, you can take a little bit of this, in this case, Southern California, and sort of map out your concentrations. As well, you can collect satellite data too. So in the end, we're hoping that this is that this tool, as we develop it, it's usable right now. We're adding more and more things as we go, hoping to streamline things so that states, local and tribal air agencies can spend time on the things that matter. And in this case of wildfire smoke, that's communicating public health information and making sure that people are aware while the event is going on, what the public health impacts and risks are. That's all I have for today. This is a picture of this is an interesting event from 2009, where we had prescribed fires in Rocky Mountain National Park going on at the same time that we had a pretty good amount of transport of wildfire smoke into Colorado from California. So you can see we had this lovely picture of the sun in the haze. But But anyway, just an example of how, you know, the wildfire smoke in the West, such an issue, prescribed and wildfire as well. So that's it.
Thank you, Mary. Our next speaker is Yang Liu, Emory University.
Thanks, Jeff. Hi, everybody. I'm going to say a few words about our study on climate anxiety related to wildfire exposure. So first of all, I want to thank NASA and NIH for their funding support of their work. Of course, the work is done by my students and postdocs. I provided spiritual support. Also, huge thanks to our data providers from these 5 states, either hospital associations or health departments, for providing their individual level health data sets. You know, I think I can quickly go through this. Climate change is making wildfires worse, and it's even worse in the Western US. We know breathing PM 2.5 is very bad. Breathing smoke PM 2.5 might be even worse because it has a different composition, although we don't know for sure what in that toxic soup is actually causing the toxic effect. We don't know about that. A big hurdle in this whole investigation is to actually quantify smoke PM 2.5 exposure. So we set out to do a couple of things. Number one is to build a high resolution, full coverage smoke PM database in the US to drive our health effects studies. And once that's completed, we can use it to investigate a variety of things. Here, I just want to show you one example. That is the association between acute fire exposure and ED visits due to anxiety disorders. Okay. So first, the smoke PM modeling strategy. The paper is currently under review. What we basically did is to classify each 1 square kilometer grid cells every day in the United States into 2 different regimes. It's either smoke impacted or it's not smoke impacted. And in the non-smoke impacted grid cell days, we built a model, you can call it a background model, background PM model. And then in the smoke impacted grid cell days, we built a smoke plus background PM 2.5 model. And then the background model can be extrapolated into smoke impacted regions. And then in the smoke impacted regions, the difference between the 2 sets of model predictions represent smoke contribution. And the key to this framework is that you have to have 2 sets of CTM simulations with smoke emissions toggled on and off, right? So that's what we did. Without going into too much of the gory details, I'll just show you some of the results. So we can make predictions every day in every 1 square kilometer grid cells in the continental US like this. We can also make maps, prediction maps like this, that is particularly smoke PM 2.5 concentrations at the daily level. These 2 models perform relatively well, I have to say, because the smoke PM level is actually very low. On average, we're looking at 0.5 microgram per cubic meter smoke PM concentration at the annual level, right? But overall, if we run cross validations, our R-square values is from 0.7 to 0.8. I think it's sufficient to drive downstream epi studies. Now, climate anxiety, what is that? I probably have heard it in the news. So basically, as we're more and more aware of the climate impacts, we start to take actions to mitigate the impact. We're also trying to adapt to the impacts that's already baked into our climate system. The awareness of the impending negative impact causes anxiety, right? It's kind of a double-edged sword. You're working to resolve the issues. In the meantime, you're a little anxious. So a recent study actually did show that nearly half of the population in multiple selected countries are either extremely worried or very worried about climate change. Of course, these are the people who are actually aware of the negative impacts due to climate change. However, we don't know, if this effect can be quantified. It makes intuitive sense, but can you put a number behind it, right? So that's what we're trying to do here. So the study questions are visit settings. Are natural disasters or climate-driven natural disasters like wildfires associated with more ED visits due to anxiety disorders? So anxiety disorder is a disease. It has a disease code, and you can tease it out from the ED data sets, right? And if that is true, what is the possible or potential pathway for a smoke or fire exposure to cause more ED visits or cause more anxiety? So that's what we're setting out to do. It's we got data from 5 Western states, altogether about 2 million ED visits, with their primary diagnosis as anxiety disorders. This isn't just a kind of a normal panic attack. This requires ambulance. You end up in the ER. It's a serious anxiety disorder. Okay. To actually quantify this, we run a case crossover design. The exposure metrics are kind of the trick here. We use smoke PM as an exposure. We also use proximity to an actual fire as a secondary exposure metric. So here are the results. I have the second column, the middle column is smoke only model. The right column is the model actually adjusted for ambient PM, ambient non-smoke PM exposure, right? As a control for the potential confounding effects from just being exposed to pollution. From here, what you can see is the smoke-only model shows statistically significant effect for direct inhalation of smoke. But once you adjust for ambient PM, that effect goes away. Major smoke events, meaning if you're pretty much, see a fire burning in your zip code, that is like 75% of the smoke of the PM is contributed by smoke in your zip code. That effect persists with or without justification, right? So what it says is, even if inhaling smoke does not cause you anxiety disorders, even if inhaling ambient PM does not cause anxiety disorders, the fact that you are exposed or you're witnessing a fire event can increase your anxiety disorder. Again, it makes intuitive sense. But what we did is we put a number behind that effect. If we do stratification, we saw that this effect is mostly driven by senior citizens. age 65 years and above. And then the effect is strongest for females. For the smoke event, again, the effect is driven by female adults aged from 18 to 65. And I skipped a lot of the details, right? Major conclusions. So we can conclude from this study, acute exposure to fire, including smoke and the proximity to fire, are associated with increased risk of ED visits for anxiety disorders. The findings point to two potential pathways. Number one is the physiological impact of inhaling smoke might contribute to elevated anxiety disorder. Two, psychological impact of being in the vicinity of a wildfire event could cause traumatic effect on you and increase your anxiety disorder. And then the vulnerable subpopulations are females and the elderly. That's all I have. Thank you very much.
Thank you, Yang. Our next speaker is HAQAST member. So Yang was also a HAQAST member, sorry. Amber Soja from NASA.
So I'm going to do something different with my time, and it's going to be the most boring looking slide set you've ever seen. There's no pictures, but I'm going to talk about the Wildland Fire Commission report that just came out September 27th. And it's going to affect everyone in this room and our future in some kind of way. So that's what I wanted to talk about. You have the links, you're going to have the slides, so you don't have to take any notes. You're going to see bullets that I'm not going to talk about. I'm just going to go through it real quick and try to get the highlights. But I left them in there because I thought if you were looking, you might want to see them. So the reason that we have the Wildfire Commission is the infrastructure bill. So they were mandated to come together and to come up with mitigation and manage wildland fire, to come up with a plan to focus on that. That was the big goal. There were other little goals, like to focus on small and impoverished communities. So if you're thinking about EJ and us, that's talking about us. There were 50 people from diverse backgrounds, and this still shocks me. They came to a consensus. Can you imagine anyone in this room, any of your groups getting together and having 50 people from diverse places coming up with a consensus? I'm still stuck there. So they're federal, they're state, they're NGOs, they're nonprofits, they're academics. The EPA was certainly there. So air quality people, they're people from communities. There's public and private organizations, and it was nonpartisan. So that to me is just amazing. And the other thing that I thought was a highlight is they had to do this. They were mandated in 1 year. So that just says we believe that fire is urgent and we need to change what we're doing. They were given 1 year to come up with this report. So the recommendations were unanimous, which I just said, from those 50 different organizations and people. There are 148 consensus recommendations that fell into 7 key themes. And in the link, it's about a 130-page report. You're welcome to read it. But they are focused on, the commission still, on congressional action, which is part of their mandate. So they recognize, and this is, all these little things are quotes, the wildfire crisis in the United States is urgent, severe, and far-reaching. It's not a simple land management issue or particular regions. So across this nation, we're having increasingly destructive wildfires. They're posing ever greater threats to human lives, livelihoods, and public safety. And so we can see where all of us fit in this room. And at the same time, they also recognize that fire is essential across landscapes. And so even though fire can play a vital role in mitigating risks to people and communities and restoring ecosystems and sustaining indigenous cultural practices, but it's a paradox because fire is both the crisis and essential part of the solution. And that was challenging to deal with. They broke into 10 groups, and each participant usually participated in at least 3 groups. If there were something cross-cutting or overlapping, they just talked to each other. So they got it done. So the 7 themes, the big themes are urgent new approaches, supporting collaborations, which is what we want to do here. And new approaches is definitely NASA. Shifting from being reactive to being proactive, and modernizing tools for informed decision-making, definitely NASA. Enabling beneficial fire, and supporting and expanding the workforce, and investing in resilience. So a lot of this is what we try to do here at NASA. So they recognize that this is an issue of public health and safety. So that's also us in this room. And they didn't just, well, they're not just giving words to Congress, they're always saying we need different governance. We need to be serious about this. Increase partnerships, which include communities explicitly, interagency coordination and accountability, not just words, but accountability for this money. So like I said, it's not a simple land management issue. It's a crisis. It's a nexus. It's a nexus between emergency management, public health, and land management. And the solutions must be comprehensive and be with society. So we have to work with communities and societies in a scale and shape so that we can change our relationship with fire and restore communities and protect communities. So you're seeing a lot of top down, bottom up themes here, I hope. Solutions can't be by federal agencies. It's not going to be by federal agencies. Individuals must be involved. And this is a quote: entities and jurisdictions at every level of society. And they're also recommending financial support for this. So it could be increased accessibility to federal programs like match waivers, improve co-management with tribal agreements. That's also, everything in here is explicit. I took these out of the report. They're not my words. And collaborations at the community scale, which is what Earth Action Strategies is doing, our old applied sciences. So they also recommended informed decision-making, which be the tools and the data that we kind of use here, or we definitely use, and as we communicate with communities, but improve data sharing. Who doesn't hear that in your Tiger teams and what you want to do? So how do you share the data? You make it usable to the communities. And we saw what when Tracy was giving her talk, I was like, yes, that's what they're saying. They know that, they want to do that. Share services and improve community decision support tools, hopefully to get rid of some of that anxiety. So they know that communities are in trouble too, and it's fear. So thanks for that, Langley. They also recognize climate change. It's rapidly shifting ecosystems. So not only changing fires, but ecosystems. So it's fundamental shifts, and we're not prepared for this. We're not prepared for this in our fire behavior models or our management structure. So we don't know how to meet these demands of today and what we will see in the future. So it was a very urgent report. Switching from reactive to proactive. And I can't even do this with my hands. So we're reacting now by fighting fires. So what they want to do is they want to put more money into being proactive so that the more severe fires go down and the proactive mitigation type fires or whatever we're doing as mitigation techniques go up. So they want more money there. And this involves recommendations of support for communities and built environments, possibly changing some building laws, planning for post-fire environments, because post-fire is the new next fire environment, improved delivery of mitigation and recovery functions. And although only through these significant investments in proactive planning, mitigation risk reduction, and the workforce needed to accomplish these tasks, can we break the current cycle of increasing severe wildfires, risk, damage, and loss? And I just had some perfect setups there all day long for this. So they definitely recognize that we need to enable beneficial fire as part of the solution, increase prescribed fire, acknowledge and support the importance of cultural burning, improve liability protection for burners because people are afraid to burn because of the liability, but we need to burn. And so it's again, that paradox. Create greater use of pre-fire planning and more integration of public health smoke management. This is with communities. So it's also an education and thinking about it. So we need air quality and EPA, and everybody has to be at that table. So beneficial fire, including more beneficial fire, enabling it. So having that possibility, which includes the community. It's prescribed burning, culture burning, wildland fire managed for resource objectives. It's all necessary to restore fire adapted ecosystems and reduce that risk of what we're seeing on the landscape now, which is high severity wildfires that pose a significant threat to our communities. So they also want to have money towards the workforce that will do this. So, and there was a recommendation of even having another workforce, not only cross training, but a separate workforce for prescribed burning, for post and pre-fire planning. A workforce focused on restoration and mitigation, year-round cross-trained people, and wages and benefits. They're really poorly paid. And a greater consideration of the workforce that is physically harmful to their health. And also it's very mentally costly, and that isn't recognized and it's not always paid for. So it's just really challenging, and we don't want to lose these people. An inclusion of non-federal partners, communities. And if we do this risk reduction leads to decreased suppression and recovery costs. So that would be the balance. So we're going to have some vision. The wildfire crisis this is basically what I said. It's it needs to be funded and acted upon like the national emergency that it truly is. To do this, we need to do less is to resign ourselves for tremendous costs and losses. So there's a fundamental need for incremental change, and the commission recommends top-down, bottom-up type approaches, no one size fits all, in order to diminish the loss of life and property and increase the functioning of resilient ecosystems. So that's the goal. They are taking this on the road to committees in the Senate and the House. These are the ones that they're going to go to first. They've already started. They're interacting with everybody because they want to push this through now. If we can do that with our committees in Congress. So they're going to work through the organizations we have now, the IWG and WFLC, and the commission remains impaneled for another 180 days so people can ask them questions, and they're just taking the show on the road. So these are just terminologies, and I'm going to let them sit here as we change over to the next speaker, and that's what I have. So I wanted you to be aware of what's coming down the pike because it helps us plan forward, and it's really integral to our community, our group.
Thanks, Amber.
Thank you, Amber. So our final speaker in this session before we go into the panel portion is Laura Gladson from New York University.
Hi, everyone. I'm so excited to be here, and I feel like those first three talks just set mine up perfectly. So I'll touch on some of the things that have already been discussed, but what I'm going to be talking about today is actually the quantification of what those health impacts are from wildland fire smoke in the United States. So, with most of this research, we're looking just at those large Western wildfires. But as Amber was talking about, wildland fires actually constitutes not only wildfires, but prescribed and agricultural burns. And together, these wildland fires constitute about 40% of primary PM2.5 emissions in the US, and they dominate the year-to-year variability in PM2.5. So this growing source of pollution is presenting additional challenges to cities who are already facing or struggling to address air quality issues related to traditional sources, such as pollution from power plants, vehicles, buildings, things that are covered under the Clean Air Act. But like Mary was talking about, the exceptional events rule under the Clean Air Act excludes wildfires from the National Ambient Air Quality Standard attainment decisions. So we really can't rely on these standards if we are going to adequately address the health impacts of wildland fire smoke in the US. The results I'm going to talk about today are from the 5th annual peer-reviewed Health of the Air report, which is a joint effort between the American Thoracic Society and New York University's Marin Institute. And historically, this report has produced as results of health impacts associated with pollution above ATS recommended levels. We look specifically at the health impacts evaluated in EPA's regulatory assessments, but we also work ahead of the curve to include additional health impacts that are not yet evaluated. For instance, a few years ago, we looked at lung cancer diagnoses before EPA included this in their own assessments. And this year, we are, for the first time, looking at adverse birth outcomes, including preterm and low weight births, as part of a collaboration with the Environmental Defense Fund. The results from the Health of the Air report are communicated to local decision makers through city-specific press releases and through our website, healthoftheair.org. Now, in this 5th report, we are adding an additional analysis considering the growing health impact of wildland fire pollution, looking specifically at those health impacts from fire smoke. So we were able to do this using funding from NASA's Rapid Response. We had exposure data from sophisticated models produced by our colleagues at George Mason University. They produced these by combining satellite and model observations to produce with and without smoke daily PM 2.5 and ozone across the contiguous United States for 2020. Similar to what Yang was talking about, this is a very unique data sets that are looking at that fire-only contribution. This is great for a health impact assessment because most of these previous assessments have just looked at binary comparisons of smoke presence or plume imaging to get a sense of what the exposure levels are. So this is a great use of this NASA funding for this project. So these two maps are showing these fire-only PM 2.5 values, the annual means of the daily values at the county level. I have split these by counties with and without federal ground monitors. Just generally looking at this, we can understand why we still don't know a whole lot about the health impacts of wildfire smoke because it's going unmonitored in a lot of cases. A lot of these, of course, are going to be those rural counties where fires are more common, but we are less likely to have ground monitors. We also see that in these unmonitored areas, there are quite a number of counties with these annual averages over 4 micrograms per meters cubed, which is approaching the World Health Organization's recommendation for total ambient PM 2.5 at the annual level. This was a small analysis I did as part of my dissertation work, looking at social disparities in smoke exposures. Here I'm looking specifically at tribal areas by comparing tribal census tracts with federal census tracts. This is mainly a reflection of the Western United States, but we see both in the West and Southern United States consistently elevated smoke exposures in those tribal census tracts across a number of different metrics. The map below is showing a snapshot of these in Northern California. The colors in the background are the annual fire PM 2.5 at the federal census tract level, and the black outlines are the tribal census tracts. And clearly there is overlap between the larger tracts as well as clusters of these tribal tracts and the higher exposure areas. Now, for the Health of the Air report, to get these health impacts, we combine the fire-only pollution estimates with baseline health incidence information. We used 2019 for our health information to avoid the obvious impact that COVID would have had on respiratory health impacts. We looked at some mortality, major morbidity, which would include hospitalizations, for instance, and adversely impacted days, which would include school and work loss days. We ran those through EPA standard health functions in EPA's BENMAP program. And we also looked at some additional endpoints that I mentioned, the lung cancer diagnoses and birth outcomes, which we ran through in R using functions selected from the meta-analyses in the literature. So combining these with local level population data, we were able to produce county level estimates of these health impacts from the fire-specific component of PM 2.5 and ozone. Looking at the results from the fire PM 2.5, annually, we're seeing an excess of 28,000 mortalities, 6,000 lung cancer diagnoses, 400,000 major morbidities, 24 billion impacted days, and 7,000 adverse birth outcomes. We are reporting the mortality estimates by individual study simply because of some key differences in their underlying methodologies. And this includes an estimate from a fire-specific study just on the short-term mortality impacts, which gives us a low estimate of 4,000 mortalities a year. And the difference between this and our middle estimate is simply a uncertainty at the moment of what the toxicity is comparing wildfire PM 2.5 to other PM 2.5 combustion sources. Looking at the fire ozone health impacts, they're quite a bit lower, only about 2 to 3% of the fire PM 2.5 estimates, which can be explained by some of the complicated interactions of ozone near fires. We do get ozone, obviously, as a secondary pollutant downwind from smoke, but around fires, ozone formation can actually be suppressed. An important consideration with these health impact studies is the strong role of population in the end results. So in this map on the left, I have mapped the annual mortalities at the county level based on the exposures from fire PM 2.5 in the map on the right. Each dot represents 10 mortalities, and I've circled areas in Florida, Texas, and the Northeast and Midwest with relatively low fire PM 2.5, less than a microgram per meter cubed, but with comparable patterns of health impacts to areas in the South that have relatively higher exposures. In this map, I have subset these mortalities just to the unmonitored areas and have highlighted some really a big pocket of unmonitored mortalities in the Portland, Oregon area, as well as a pretty uniform spread of unmonitored fire-related mortalities in the southern United States. The Portland, Oregon area, I've listed these counties, these just the unmonitored counties by those with the top death counts. Looks like there are some fire-related monitoring needs in the Portland area. And then, of course, Florida and Texas with their high populations are driving those higher health impacts. This just demonstrates these might be areas that could really benefit from satellite and model data, in addition to more ground monitors. So we have these health estimates at the county level and city level. And like I mentioned, we communicate this to local decision makers, and we're actually using part of that NASA funding for a big communication push later this month, where we're going to be promoting it through national media outlets as well as city media outlets. Hopefully it can reach those stakeholders most interested in this, who can then actually have counts of local level health impacts so they can address these smoke exposures in meaningful ways. I'll just wrap up by thanking those who were part of this project, especially Daniel Tong and Yunyao Li at George Mason University for producing those modeled fire exposures, Julia Golke at the Environmental Defense Fund for helping with the birth outcomes analysis, and Gary Ewert with the American Thoracic Society, and of course NASA for that rapid response funding. Thank you.
All right, so now we want all the speakers to come back up for the panel portion. Yeah. And I'm sure there are many questions, so, oh, I already see one. Patrick.
Mary, does the exceptional event demo package handle more complicated tier 3 analyses?
Okay. It in some ways, yes, it probably needs more enhancement though. The demo tool itself, is only as good as the folks in the West. And actually we've got some Easterners too working on it as well. It's as good as the state, local, and tribal folks who write the code are right now. So, I mean, I think we envision enhancements in that way for I think you're talking about the ozone and the tiering for the ozone. Yeah. And that's probably the most difficult demonstration that you can do is the ozone demonstration. So, yes, with qualification that hopefully it'll get better.
Thank you.
Gia and Michael.
My question's for Young. Hi. First of all, your work is super cool. The research is awesome. My
you.
question is, of the people who were talked to about wildfire anxiety, do you know if any of them were asked specifically about how much social media or news media content they were consuming surrounding the event at the time that may have affected that anxiety as well?
Good question. I don't know, but I can get back to you on that.
Actually, there's two Michaels in the same spot that have their hands up. I saw Michael Cheeseman first, then Geiger next.
Hi, I was just curious about the exceptional events. Is there a realistic concern that a reduction in the PM 2.5 standard from NAAQS would lead to a reduction in prescribed burning, or at least a deferral of prescribed burning because the exceptional events reporting process is so complicated?
Well, of course, so prescribed fire is regulated by the local, state, or tribal authority. And so I can't answer for all those different authorities, but there is EPA has made a concerted effort. There is guidance on how to do a prescribed fire smoke demonstration. There hasn't been one done yet. So I think that's a little bit, like everybody's kind of like, oh, what's that going to look like? Will it be concurred upon? But theoretically, no. And I think there is some, EPA sits on the commission. And I think everybody realizes that prescribed fire has to be in this calculation. And I think states, locals, and tribes want healthy landscapes. So I would say,
So you don't think that they'll defer it then?
I don't think so. I think everything is being done to make sure the tools are in place so that prescribed fire exceptional events demonstrations can happen. Now, the great thing is that there's a lot of prescribed fire that hasn't adversely impacted monitors, and that in itself is a really good success story for prescribed fire.
Thank you.
Okay, Michael Guy. Oh, you wanted to talk? Go ahead.
Is anybody on the Wildfire Commission here in this room? I thought maybe Mary would be, but no, by her question. But we don't know what's going to happen, but I know that when I go to communities like strategic management communities, fire communities, they use EPA standards, and when they might smoke out a community as a go, no go decision, and then it's no go. Well, they only have so many days, let's say 60 to burn. 30 of those people are sent away. They can't burn. Half of those are, other things, the conditions aren't right. So they end up having only days. And if it's a no-go because they think a community might get smoked out, that's because of regulations. And so it might not be an exceedance, but it's what's happening. And at these meetings, when people from the EPA, not all of the EPA, are there, they're like, why are they even saying this? We have nothing to do with go, no go decisions. It's like, but the rules and regulations affect the go, no go decisions. So at some point, we're all going to have to come together on that and make it easier for exceptional events. I think that, but that's just me.
Okay, well, it's a good segue, Amber and Mary, into the exceptional events, because Connecticut is doing 4 exceptional events because of the smoke on ozone, and the first one in April has a lot to do with prescribed fires. We may be the first to submit a request for prescribed fires because thousands of fires occur every day in the Southeast states, Mississippi Valley and Flint Hills, 2 million acres a year get burned, and we see the plumes, and usually it gets dispersed. It all depends on the weather patterns. They burn over a period of a month, and I have to think they try their best to pick a day where it's not going to influence people. But the weather this year was just working against us because it blew all the smoke east and just created this constant light haze, and it affected our ozone. So again, I want to ask Laura though, because I'm familiar with Daniel Tong's modeling, but again, 2022, there wasn't much smoke affected on the eastern states. 2021, there was. 2023, there was. Incredible. We need to get that model run for 2023 as soon as possible for our exceptional events, because it's really hard to know exactly how much the PM was affected. Now, PM versus ozone, but when we do an ozone exceptional event, we'd like to know there was PM from smoke involved. So that's the challenge this year. I'll talk to Daniel to get that model run, perhaps, unless you run it, but that was my question. Okay.
What was your question, I guess? Did you have a health? I mean, no, I'm not the one running the model, but that, like I had mentioned, the wildland fires are driving that year-to-year variability. Like you were saying, we have years with really high smoke and years without. Our analysis, of course, was just 2020, which was the first year with a giga fire. So obviously we weren't able to compare as much with past health impact assessments. Our estimates were at the higher end of those previous estimates. But again, another thing that makes it difficult to compare is that this model includes biomass burning. Some of those previous assessments don't look at agricultural smoke. So there's just not a lot out there yet to, compare with past literature, but certainly having multiple years would increase our certainty of these estimates.
Leaf Balson, Wyoming DEQ. For Mary, using the new tool, has there been any regional concurrence using the new tool?
Yeah, no one has submitted a demonstration with the tool yet. So folks are just using the tool to archive the data they might need in the future.
John Horrell here, University of Utah. Laura, it was very interesting and very useful. I just want to understand a little bit more about your non-monitored category. Portland, that was like an exceptional year in terms of fires there. So how do you define non-monitored areas?
Yeah, sorry, I went over that pretty quickly. So I'm specifically talking about EPA's federal ground monitors, those stationary monitoring stations, which are used for the NAAQS attainment decisions. When you go to EPA air data, that's what you're downloading. So that's the key to monitored versus unmonitored areas. And I did a lot more work with this kind of idea with some of my thesis stuff. I looked specifically at social disparities between monitored and unmonitored areas as well, relating to smoke exposure. It's just an interesting way to look at it when you subset it that way to see, hey, these are places that might use more ground monitors or would especially benefit from satellite data since they don't have those federal monitors. And I should add, these federal monitors are highly standardized and they're very accurate, but they're very costly and take a lot to maintain, which is why they're focused just typically in those high population urban areas. But that does put wildfire smoke research at a disadvantage, which is usually occurring in the rural communities.
We have an, it was okay. We have an online question from Malcolm Zachariah. How have the reports and models accounted for Canadian wildfire and other international transport of smoke impacts? It's from Malcolm. Sorry. How have the reports and models accounted for Canadian wildfires and other international transport of smoke?
I can start with it. Probably not very well. We have a hard time getting just even anthropogenic emissions data from other countries, let alone information about wildfire smoke. I think there have been some strides made. This particularly after this summer, there's been a lot of interest in mapping the locations of the Canadian wildfires and getting the kind of information we get about wildfires in the United States from the Canadians. And I know that efforts are underway to get that information and get that to folks at air agencies in the United States. But generally, those are kind of difficult things to discern. So including them in any modeling we're doing to any great accuracy, we have a long way to go.
I don't have too much to add, but there are definitely Canadian researchers doing modeling of the North America generally. We've done, unrelated to the work I presented today, but done some work using that information. I don't know if the resolution is very high for those models.
I think I can speak for Yang and Daniel and the work our group does. I think our models would be kind of treat Canadian fires similarly as US fires in terms of mapping out exposure. Would you agree with that? Yeah.
Yeah. Do you use Modus land cover? So the land cover would be the same?
Ours
That's
doesn't use
question.
that, but yeah, go ahead, Yang.
So whatever the satellite sees or whatever the HMS system records go into our model, right? So basically they're compounded or combined effects of all different fires. Because we're running kind of data-driven empirical models.
Okay, I thought I saw land cover on your, but maybe I'm confusing slides. So a forest would have a different emission amount and factors than a grassland would say. So we just have to have the Canadian land cover, and if you're using Modus, then you have it.
Yeah.
right?
So the study I presented, the study domain is limited to continental U.S.
US. Okay.
Yeah, but we are expanding to cover southern Canada.
Okay.
So the health study is still US based, but once you have the buffer, the exposure assessment in the US will benefit from the knowledge of, knowing there's smoke coming in from Canada.
Sure. I think that Blue Skies and other models use the background, even like from Siberia. So we are getting some background in the large scales models. I don't know if Brad Pierce is in here. The big ones do, like the ones at Goddard or Rackham's, which is Brad. They use background knowledge. So they do have that smoke coming in. Blue Skies is also, there's Blue Skies Canada, and Blue Skies is what the EPA uses. So and the Canadians do an excellent job of looking at fires and quantifying the burned area and getting the perimeters. I mean, they're as good or better than us. So that's very doable, I think.
Just one follow-up, because they had asked about the report too, and I was running in and out, so I don't know if I missed this, but does the report, did you also talk about the sort of the international implications or how to cooperate on land management or anything like that?
It was strictly a US report from US organizations and trying to get ourselves together. But I would imagine that it should serve as an example, because climate change isn't staying in our borders.
Amber, if I could ask you a question. You kept using the language of beneficial fire, which is what's been adopted by many US agencies. This idea that when talking about for ecological purposes or for reducing structures being destroyed, prescribed burning is more beneficial than, uncontrolled fire. The problem is, from a health side, our lungs don't know the difference. And there's some difficulty when EPA wanted to revise their AQI cut points, for example. Other agencies said, no, don't do that, because when we do prescribed burning, you're going to tell people the area is unhealthy. We don't want that. Could you comment a little bit on some of this tension and how we can maintain a health focus even while trying to do a better job of ecosystems and structures burning? Can you speak to the health implications of that phrase, beneficial fire?
Yeah, I think you're right. And I believe that the Wildfire Commission struggled with that as well. So when they came out with the consensus, I just kind of got stuck there because it's everything that you're talking about. And with one of the comments that someone made to me is, yeah, sure, there's beneficial fire, and we see that even if they didn't, I mean, before they did now, but there is no such thing as beneficial smoke. So at some point we're going to have to reach a balance, but in order to mitigate for the extreme fires and get those to come down in terms of being proactive instead of the reactive. And reactive just isn't working. We control 98% of the fires. It's not working, and still communities are destroyed. And I don't know. I think the commission is right. That's what I think. I think that we do need to increase prescription fires and mitigation and pre-fire and post-fire for the next season and get our ecosystems under control in order to control the really bad smoke. And I just, what we said before, I mean, I would like for exceptional events to be a little bit easier, but of course not EPA. But I think Connecticut shouldn't pay for the Flint Hills or whatever smoke it may, or Canadian fires, whatever we have that comes into the States. It's a mess, but in order to get it under control, we are going to have to mitigate partially using beneficial fire. It's going to have to increase a lot. They're talking about a whole workforce. So we can't even do it with the workforce we have now. So if even part of what's pushed through, it's going to be big changes.
My name's Heather Holmes. I'm from the University of Utah. Sorry, I'm back here. Thank you all for spending time on this panel. Your presentations were great and the discussion super thoughtful. I have a quick question for Laura. It's awesome that you have all these different health endpoints and things like that. I was curious, what was your exposure windows? Did it vary by endpoints, or was it an annual exposure for all of them?
Yes, we looked at annual exposures. So when you're talking specifically about PM 2.5, or for any pollutant really, you can either add up all the short-term impacts over the course of the year or just look at an annual function. But we've actually seen for PM 2.5 research, the annual impacts are larger than the sum of the short-term, mainly or likely driven by some cardiovascular associations with just that chronic exposure. So for these, we are looking, there's a little bit of a mix. It's all based on the EPA standard health functions. And for those additional endpoints, we're using annual concentration response functions.
And so, because I think you had like a respiratory health outcome, was that the case? Or was it respiratory related mortality, or was it like a respiratory ED visits?
The major morbidity outcomes, it's mainly respiratory hospital or ER visits. So obviously those are more short-term impacts. They're going to use a short-term function, but then adding those daily impacts up over the course of a year.
Got it. Thank you.
Yeah, great question.
My question's for Yang. Since anxiety rates tend to be higher in urban areas already, did you find a significant difference in the proportional impact of wildfire smoke on ED visits in urban versus rural?
We didn't do that stratification, but I think it's a good point. Exposure in the rural population is definitely higher. It's probably, our estimate is about 40% higher for the rural populations. So in terms of the absolute impact, it's going to be higher in the rural areas. But in the EPI model, we did not attempt to see if the odds ratios in the rural population would be different from that in the urban population. The more I studied the health impact of smoke, the more sort of curious I become. We've seen many unexpected results. Like, we can quantify this kind of stuff now. In the previous study we did with the American Cancer Society, is like just somehow the proximity to smoke, to fire event would affect your cancer surgery recovery or survival. There are just so many unknowns in this. I mean, we're happy to take the first cut at this problem, but I think there's going to be many follow-up studies in this overall, psychological, physiological nexus of the impact.
Yeah, I'm curious because with PM 2.5 being higher in some urban areas already, if rural populations being exposed might be more resilient to the acute exposure, at least their response to anxiety. So
I might have to think about a study design that can actually test that.
Yeah, I know.
It's just hard to find a reference point, like a totally not resilient, vulnerable community. Right? So,
Sure. Yeah, thank you.
Thank you all for your presentations. It was great. I have a question for Mary. Specifically, I'm curious about like the logistics of the exceptional event demo tool. Is that something where you kind of like input your day and your location and then it automates getting the different data sets for you and like plotting the satellite data, plotting the monitor data, high split, possibly just getting those figures?
Yeah, that's the idea, that it all becomes more automated, so it's less time for folks to spend doing all of that.
Okay, thank you.
Right. I'll ask a question then. I think we have time. Yep. All right. So I've been like on the periphery of smoke and health studies for some time, as many or all of you have. One thing that always bothers me, I mean, this is true, I guess, in all air pollution, but getting to personal exposure and knowing that in some areas of the US, if we're doing a whole US study, some areas people are more likely to have like air conditioners or HVAC systems in their home that are going to clean the air in their home. And other ones are more likely to open their windows because it's hot and smoky. And then we're lumping it all together when we're trying to do like epi and those sorts of things and coming up with some function. What are the next steps? What should we be doing to understand personal exposure better?
That's a great question. Again, especially with smoke exposure, it's highly complicated. Like if you can visibly see smoke plumes, you will take action to avoid being exposure, right? So in that situation, you may not actually be exposed to smoke. It's when you don't see the smoke is mixed and dispersed in your community, you don't even smell it. You open the window, you go on with your daily activity, and that's when you actually get exposed. So this personal exposure versus ambient exposure issue, this confounding issue, is perpetual. In our study, we can only use proxies to control that, right? Use their socioeconomic status, county level income, access to healthcare. These have a community level parameters to control potential confounding. If we have better data for ED data, for example, we cannot track the patients. This is not a longitudinal study. Every time what we record is the incidence of the ED visit. But in cohort settings, you have a lot more control, individual level control that we can get down to kind of more nuanced analyses.
A couple thoughts on that. I think an important next step would be get higher resolution data if we're talking just about the epi studies. With our analysis, we originally were considering looking for the birth outcomes at like the mother's race and ethnicity, and also if they were a Medicaid recipient, but you really can't, it's tricky to do that at the county level because there's so much within county variation. So that could be helpful, which obviously that's where the satellites and the models are going. But I almost think, I mean, we know, having your windows open is going to increase your exposure, those different things. There's some interesting work done up at UBC where they're producing these kind of worksheets almost that physicians can work on with their patients, where they're like, okay, if it's hot outside and there's smoke do you open your window or not, you know, because it's difficult. How do you make that decision? So it almost feels like there needs to be a lot of communication with the healthcare providers in that case until we can get better, you know, highly specific data.
Yeah, it's a great question. And you guys did great talks. I really liked them. Thank you. They were helpful. So, and getting back to what Kevin's question and yours, Jeff, and everything feeding on everybody. So if we accept that we know that smoke is bad and the health effects bad, and it's particularly bad in communities that are impoverished and can't afford the air conditioners or the HEPA filters, or what can we do? And if the Wildfire Commission is, oh, I see somebody wants to speak, but if the Wildfire Commission is going to put money into communities and go into communities and say, hey, listen, this would be the firefighters, if we burn your community, it would be a safe space for firefighters, saving your homes. And so if as long as we're talking to communities, maybe there can be a school with HEPA filters, or if it's like a persistent smoke, like in West Palm Beach or in the Flint Hills, maybe have the kids in schools with HEPA filters or air conditioning. So if we're working with the communities, and we have some community people here now, but if we are starting to reach out as a larger or society to impoverished communities, then there will be representatives that can work with people that can come up with some solutions, because I don't think the solution is ever going to be that we're going to see less smoke. So we're going to have to think of different ways to do this with communities.
Yeah, this is Claudia Yeoman with the Air Pollution Control Bureau in Chattanooga. I was thinking, I mean, it's great that we have all the studies, and I really do appreciate you guys working on this, but also at the same time, working on what Amber was saying. I mean, I would like to hear a little bit more about all the smart people in this room trying to come up with alternatives to burning. So what about biochar as a way of management for impoverished communities that will bring in some, for example, ways of making money, fertilizing and stuff like that? Can we work a little bit more on the solution? Can we maybe, instead of grabbing all these beautiful tools that we're getting and the studies and trying to come up with practical solutions that we can provide to the new law that is going to be passed at Congress, or like maybe using the money for that kind of research and stuff like that. I would love to see like the practical portion of it.
Me too. If we like had a whiteboard or something, I mean, something that would be like a fun thing for all of us to do together. But also there's been some suggestions that I've heard even today, like let's say green harvesting of sugarcane. That could be one. So it's not going to be like the commission said, you're going to have some top down, but that's not going to work, especially from federal. You're going to have bottom up solutions as well with the communities. And I think that's what you're talking about. And Europe, they have a lot of problems about, they used to use the landscape and live in places where they used it. And now they don't. And it's horrible. And they have what they call hooligans lighting fires. So they have different problems than we do. And so they're talking about using the land again, putting goats on it, having more people living in the villages where you go out and you collect the berries. So you're stomping around. And so you're using the land for fuels. That doesn't work in the United States, but it's a different kind of solution. And that's what you're talking about. So there'll be community-based solutions. But it would be good to get everybody together. I certainly don't have all the answers.
Yeah, I mean, it will be beautiful to kind of work with groups and have cohorts of people that we can kind of, the same kind of studies. So we take a community and we see what the results is, and then we imitate that in someplace else, and we see what the difference are. I mean, this beautiful data and this beautiful mind will be great too. I know the United States is humongous, and probably one or two communities won't make a difference, but we could try it and kind of see where it takes us.
We did a little bit of work in the West to try and figure out what prevents prescribed fire 5 or 6 years ago, and looked at just a couple of states and prescribed fire burn permits and when those were granted and that kind of and overwhelmingly and this was pre-COVID, there just wasn't many times, the majority of times when a prescribed fire was canceled, it wasn't because the air agency wouldn't give them a permit. It was because they didn't have enough people on the ground to conduct the burn. And so when you think about, that was pre-COVID, when sort of workforces were more robust, we had more people to do these kinds of things. I'm skeptical that we're going to be able to prescribe fire our way out of catastrophic wildfire. And so they're going to have to be answers on many fronts, and probably, lately we've been talking in the West a lot about, catastrophic wildfire burning through urban areas, similar to what happened in Lahaina most recently, and the Marshall Fire, those kinds of things. Do we need to do, is there some strategy around preventing those kinds of fires? Of course. But in general, what I think is that we are going to have to, in the end, try to do all these things, try to do as much prescribed fire and other alternatives, but we're also going to have to adapt. And I think there's a big effort in many air agencies, local, tribal, and even state, to get out the word about building box fans for people to have in their homes, the people that don't have air conditioners. And perhaps maybe there'll even be some sort of federal subsidy to help everyone have something in their home that can help to filter the air, because we know long term people can't go for a month and stay somewhere else. That solution, 20 years ago, I think we would hear that when there was a catastrophic wildfire in the West. Well, you should go away. And we know that's not realistic for most people.
I like how your response kind of like got depressing and then turned around and ended optimistically, because we're out of time. So that was how it was going to end. So let's thank Yang, Mary, Laura, and Amber one more time. And thank you for your questions.